Good morning, good afternoon, good evening, colleagues, wherever you're calling from. It's a great pleasure for me to join you today virtually in this Annual Partners meeting. We at UNICEF are proud to be part of this critical partnership that is helping and supporting countries to advance their effort in eliminating yellow fever. And this partnership aims to provide global oversight, coordination, and support regions and countries for detecting and preventing yellow fever outbreaks. Since the inception of this partnership in 2017, over 200 million people have been protected against yellow fever in Africa. And this number is expected to reach about 247 million by the end of this year if all planned campaigns go as planned. The I partnership has been able to adapt swiftly and in effective ways despite the global challenge posed by COVID-19 related disruptions. And it's not only yellow fever, but the global disruption by COVID-19 and the restrictive measures have impacted the overall coverage of immunization. As some of you may have heard, and as immunization community members, a total of 25 million children have been missed from essential immunization, being under-vaccinated or unvaccinated in the year 2021. This is 2 million more than what we had in 2020 and 6 million more than what we had in 2019. This is to shed light on the fact that it's not only yellow fever, but also the other vaccine preventable diseases that the COVID-19 vaccination-related disruptions are impacting. And this offers another opportunity as the Immunization Agenda 2030 is attempting to make sure 2023 and forward is used as a year of recovery, a year where the immunization coverage will return back to pre-pandemic levels with a concerted effort of all partners. The I partnership has been able to adapt swiftly and in effective ways to avert the COVID-19 pandemic-related challenge and can use this opportunity to further this agenda going forward, as this recovery effort would mean reinitiation of new vaccine introductions and also expansion of restarting of campaigns that have been planned in the past. I am proud that we at UNICEF played a critical role in maintaining the delivery of yellow fever vaccines to countries who have been conducting campaigns and also introducing the vaccine. We were successful in our efforts to introduce yellow fever vaccine in countries for their national schedules in this year. I'm hopeful of us achieving this goal in Ethiopia and South Sudan, as well through our joint advocacy work, just like the way we did it in Uganda for this year. Together with our I partners, we are steadfast in advocating for sustained and improved routine immunization coverage to prevent yellow fever re-emergence, especially in West Africa, as we aim to eliminate yellow fever epidemic by 2026. These efforts, as I earlier stated, do complement the broader immunization strengthening effort and can make best use of the opportunities the recovery effort are availing. We must ensure that no one is left behind from the benefits of vaccination. Working together, we can protect over 1 billion people from yellow fever in Africa and in the Americas by 2026, as we have clearly outlined in our elimination plan. Yellow fever cannot be eradicated, but we do have the potential to eliminate the epidemic. Without the work of the I partners, yellow fever has the potential to again lead to devastating epidemics with the international spread as we saw back in 2016. We cannot let that happen on our watch, and we have all the tools and the commitment and the means, and perhaps the strongest partnership in the immunization space to be able to be used to respond to this challenge. We at UNICEF know that working together is the only way to eliminate yellow fever epidemics, and we must work as one, and we owe it to our children to do so. UNICEF continues to be committed to the effort of this partnership. Thank you again, and I wish you have a wonderful deliberation and continuation of discussions. Thank you so much.